Hello viewers, welcome to Uron, urologist on air. So we are going to have conversation with one of the great urologists of all the time, and today he is here with us, and we are going to ask him a few questions about BPH. So sir, before starting any question, I'd like to request you to please give a brief introduction about yourself.
I am Dr. Arvind Agarwal. I am from 1972 batch BHU. I am working in Ranchi. I started urology way back in 1989 there, and over a period of time I've been working in Agarwal Modi Seva Sadan Hospital, Upper Bazaar, Ranchi, and Orchid Hospital, and previously I was working with Raj Hospital too.
Sir, my first question to you is, why the cases of BPH are on high rise?
One has to understand from the beginning that the BPH or benign prostatic hypertrophy is normal aging of a normal person. It will happen in all males above maybe age above 50 years of age, and around 50 years of age it will be there in around 50% of population, and it grows like 60% at 60 years of age, 70% at 70 years of age, 80% at 80 years of age, and 90% at 90 years of age. So it's a normal aging of a normal male person.
Okay, sir. My next question, why does it become so important for the condition to be diagnosed at an early stage?
BPH or benign prostatic hypertrophy, being what is called normal aging of a person, will happen in a very large percentage of population, as you have already understood that it will be there in around 60% of people at 60 years of age. And because it's a normal aging, it will impact the passing of urination, and if it impacts the passing of urination, it will have consequences over a long period of time, and completely disturbing the normal life altogether. So it is of a great consequence.
Okay, sir. One more question I'd like to add. What are the complications that could develop if BPH is not diagnosed early on? Can you share a few instances that you have come across during your practice that may help in educating the viewers?
As I said, this is normal aging of a normal person. So if one has to see the aging, what happens? There are 5 things that happen in a normal aging of a person. One is graying of hair.
Yes.
It will start early in some people and it will be late in others. But everybody will have graying of hair over a period of time. And then there will be what is called development of what is called cataract in both the eyes. It will happen earlier or maybe late. Third is taking out the teeth. The teeth will fall down. And fourth is the what is called this skin will become slack, and it will become crumpled up. And the fifth thing is the passage of urine, which is this big, will become narrow over a period of time. And if it becomes narrow, the patient will not be able to pass time. We have seen that we have not been able to develop any medicine which will cause new black hair coming out. We have not developed any medicine for what is called cataract that will dissolve. We have not developed any medicine for what is called a teeth will come out, a new teeth will come out. Or we have not developed any medicine which will cause tightening of the skin. But way back, 30 years back, the urologist or the people who are working in the pharma industry, they have developed a medicine which will open the passage for 24 hours. And that is good enough. If one can open up the passage for 24 hours, you have taken care of aging. The aging is there, so the patient will be able to pass urine for 24 hours. So it is like any other medicine, it has to be taken on a day-to-day basis. This was developed 30 years back. After 10 years more, people have developed a medicine which will shrunk out the prostate, and the prostate will become shrunken, and the effect, both of them taken together, is double or maybe 3 times. And if both of them are taken perpetually, and if you do not take what is called newer medicines which are artificial medicines or generic medicines which will not have effect for 24 hours. All these branded companies come medicines, they have an effect which lasts for 24 hours. And if it is taken perpetually, they are like any other antihypertensives or any other medicine taken for diabetes or others. So that will open up the passage and the patient will be able to pass urine downwards. If you do not take medicine and the effect is there and the area is clogged up, because it will happen gradually over a period of time, then the urine will go up in both sides of kidney, and the kidneys will swell up with the urine, and the function of the kidneys will be hampered, and that is called kidney failure. Kidney failure is not a small thing, it is kind of permanent, and if it happens, if initially one is able to remove the obstruction, it may recover, but once it becomes permanent, then the only thing which is left for people to do is hemodialysis. Hemodialysis is done twice a week. It is done perpetually for lifelong. It's a very, very crippling population. And that can be very easily avoided if the patient has developed the symptoms of obstruction and if he is taking a medicine on a regular basis, perpetually, continuously, without fail.
Thank you so much, sir, for
Thank
your
you.
kind words. I think you have educated our viewers a lot. Thank you